Hey friends, it's Susan from legslikeMine.com. So today I'm going to be actually looking at some notes today to make sure that I get all the information to you. I want to talk a little bit about compression therapy and why it is so important for people who have lipedema to use compression therapy when it's indicated, right? There are some folks who can't. But it's just so, I get so many questions from people about wearing compression that I thought, okay, I've done a blog post on it that I posted on May the 30th of 2024. And I'm going to go ahead and throw this video out here to help other people who prefer the video format. So before we start, I want to talk about lipedema in general. So lipedema is a chronic progressive disorder that affects women for the most part. And what we see in it, it's the abnormal accumulation of subcutaneous fat in our arms, our legs, sometimes our trunk, and of course, other body parts, which all of us are different, right? But this fat distribution is accompanied by pain and tenderness and easy bruising in the affected areas. And we know that those areas are resistant to diet and exercise. So you may have tried all kinds of diets, and you're still not losing the fat. And we see that so often with people who have lipedema. So, compression therapy is basically donning garments, putting your body under extra pressure to help with some of the symptoms of lipedema. And the things that compression can do for you is it can help to reduce pain and swelling. So, when you have your swelling under control, it really does help with pain. That gentle pressure that's applied by garments can also help just keep it under control, right? The way it works is it improves your lymphatic drainage. So it can, lipedema can impair the proper functioning of your lymphatic system, which is like the one of the most important systems in the body and not that well studied yet by the medical industry, although we're working on that, right? What we do know is that wearing compression can help facilitate lymphatic drainage and reduce the risk of complications or even the development of lymphedema, which can turn into more serious situation. And so in general, that is helping to prevent the progression of lipedema. Maybe it'll help save your mobility. Maybe it can help further complications. So, it's really important. And I want to stop here and say, consult your doctor, right? Talk with your doctor about the use of compression therapy. In general, it's safe and effective for lipedema management, but there are certain conditions that don't work well with the use of compression garments. It's contraindicated in some situations. So before you go off to Amazon or wherever and start your own compression therapy, it is so important to talk with your healthcare provider, especially if you have any other medical conditions or concerns. Okay? All right, so there are all kinds of different compression garments. You will see a lot of ladies who wear compression stockings that go up to the knees. Some ladies wear thigh highs, and like me, I wear, in general, the kind that goes up like all the way up to my waist, down to my feet. They can go to your ankles, or sometimes I even wear them that go over my heels, depending on whether my feet are swelling on that typical day. The thigh high ones, they're a challenge, I have to tell you, especially for ladies who have lipedema. We, in general, tend to have larger thighs, and they do sell glues that you can use to hold the thigh highs up. But in my particular situation, they don't make a glue strong enough to keep to keep a thigh high on. So I go either with the knee or the full body length kind. They also make arm sleeves, and those come in a couple of different styles too. The ones that I see a lot of breast cancer patients who have lymphedema. They wear the ones that start here at the wrist and they go up. It's just literally like a tube that comes up here. A lot of ladies also have the kind that fit on kind of like a little bolero jacket, and they either just slip over the shoulders or even they fasten underneath the bra. And whenever ladies have arm surgery, you'll see them wearing their compression arm sleeves. There's also bandages, and the bandages, they're like a necessary evil. You see those happen a lot whenever a person goes to a lymphedema therapist for some initial consultations type stuff, and they get wrapped. We call it being wrapped, right? And that will involve like layers of non-stretch bandages or short stretch bandages with foam, and it's usually part of a complete decongestive therapy type situation that's combined with massage and this compression bandages, and then the wearing of compression garments after that is done. And the gist of that is they're trying to get that swelling out and shrink you down so that then you can just start wearing compression garments to control it. I actually use a brand of compression bandages at home for short term. They're made by a company called Fast and Go, and they're thinner and they don't involve the use of foam. I really, really like them, but they're kind of expensive. Anyway, if you're interested in those, I'll put a link down below. I'm not an affiliate marketer. I just really like their product because wrapping, frankly, is a pain in the butt and it's hard to keep them up and stuff like that. But this Fast and Go product is an amazing invention and I really appreciate that. So, the last kind of compression I'm going to talk about is wraps, and they're made by all kinds of different companies. You can find them on Amazon or at different companies that I'll talk about here in a minute. But a lot of times they're elastic or they're the fabric that scuba diving suits is made of called neoprene. And you wrap them around the body part and then you fasten them and make them tighter by pulling the Velcro tighter. They're usually, held on with Velcro. And that way you can control the amount of compression you're getting. You can also use wraps on top of other compression if you have a special situation. So a lot of times when I'm traveling internationally, I might take a wrap and put it on top of my compression pants, and that way I can keep a specific area of my left leg from swelling up as bad. So that's the different kinds of compression.